Number one, eat slowly. Take your time when you're eating. Do not rush through meals. Also, make sure your meals are small. No large meals here. Smaller meals are going to help you out. And third, only eat when you're hungry. I'm giving you tips today on how to reduce the side effects of GLP-1 medications. In particular, we're talking about gastrointestinal side effects. Let me know if you take a GLP-1, what your symptoms are like if you've had symptoms. As a family doctor, I prescribe these medications almost every day in the office. Some of the common side effects I see and my colleagues see, and you might have experienced, are things like nausea, vomiting, diarrhea, constipation, bloating, the gas, stomach cramping, even acid reflux. And of course, there are plenty of other side effects that can happen as well. We're just focusing on the gastrointestinal ones today. Now, these side effects can range from mild and not a big deal to very, very severe. And let me just tell you right now, if you have severe side effects, that's an ASAP to the ER, to your doctor, etc. Okay, if something's severe, you see your doctor. But mild side effects sometimes can be managed with simply some lifestyle changes and changes that your doctor can make. So I'm going to give you sort of 3 buckets of advice in this video. The first is things you can do at home to help gastrointestinal symptoms. The other thing are medications that may help with the side effects. The third thing are things that your doctor can sort of advise or suggest you do or make changes with your medications to help as well. Okay. All right. So if I haven't said this, I'm Dr. Jen Cottle. It's good to see you. Let's go back to things you can do at home. The next thing is to avoid laying down after a meal. You know, when you eat a meal, and by the way, these should not be big, heavy meals, okay? Make sure your meals are smaller. Avoid lying down immediately afterwards. Stay upright for a while. That's going to help with digestion and hopefully may help minimize some of your gastrointestinal side effects. Also, consider just chucking the straws. Yeah, like avoid using a straw because using a straw can actually introduce air into your gastrointestinal tract. Could potentially make things like bloating and stuff like that worse, okay? Now, along the lines of what I said in the beginning of the video, I said, eat small meals, eat slowly, only eat when you're hungry. The other thing is to stop eating when you're full. When you are full, don't push it, okay? So the cramping, the nausea, etc., sometimes that's simply minimized by changing how you eat. But other things, make sure that you're increasing your fluids. Okay, you can drink too much water. I always have to say that, but it is important to make sure that you are staying properly hydrated. That's potentially going to help your symptoms. Also, the food that you eat does matter. Okay, so avoid the fried and fatty foods, sugary foods, and stuff like that. It's probably going to be tough on your stomach. A low-fat diet is going to be helpful. Make sure also that you are exercising. Very, very important, okay? There are other suggestions as well, things in terms you can do at home, but I like those as a core place to start, especially with like your meals, the timing of the meals, and how you're approaching eating. Let's move on and talk about some medications that you might benefit from if you have some of these symptoms before I talk about other things your doctor can do with your GLP-1, okay? So first thing, keep in mind that it is possible, like sometimes I will give recommend a patient take a stool softener or something if they have constipation with a GLP-1, or I'll give them, maybe a nausea medicine if they have nausea. Okay. Now remember, you want to try the lifestyle changes that I suggested first before going to a medication, because just changing how you eat may change the symptoms. But yes, there are medications for a lot of this stuff. And of course, when you're nauseous, and if you're nauseous, do things that help you not be nauseous, whether that's ginger or ginger ale, taking a nausea medication, eating really bland foods, stuff like that. Same thing if you have diarrhea or sort of an upset stomach. And with constipation and things like that, there are stool softeners and other things. Let me make one comment, though, about what we call bowel changes, okay? Because this is something I've had to deal with my patients, as a family doctor when they start GLP-1s is, one thing that we always have our antenna up for with patients is a change in bowel habits, meaning person has a bowel movement every day and all of a sudden they only go once a week, or all of a sudden they have 5 stools a day and that's not normal, or all of a sudden they have diarrhea and they normally don't. A change in bowel habits sometimes can indicate that there's a problem with your colon or gastrointestinal tract, and we usually like to usually do refer to gastroenterology to look at them to make sure, hey, there's no colon cancer or no underlying condition, okay? I say this all to say that when you start a GLP-1, it would not be uncommon for you to get gastrointestinal side effects. And sometimes I've literally had to say to the patient, okay, wait, do we think this is your medication, or is this potentially not the medication and something else? And with that, sometimes we don't always know in the beginning. So be open to your doctor recommending you see a gastroenterologist if something doesn't quite seem right. Now, let me tell you, blood in the stool is never okay, and you should not have that with GLP-1. So if you ever have blood in the stool, as an example, or black stools, that's always a gastroenterologist. That's always being evaluated right away. But just know that we may get a little nervous when you start telling us that your stomach and your bowels are different, because we may not know if it's just the medicine you started or if it's something that could be more sinister, okay? So to that end, yes, we might give you nausea medication, stool softeners, and things like that. But we also might recommend a gastroenterologist, which I actually have done for a couple of patients that I've just been a little bit suspicious about, okay? Now let's talk about how changing the GLP-1 that you're on can make a difference, right? Because it's not just the things we talked about. One thing that needs to happen when you start a GLP-1 is you really need to be started on the lowest dose and slowly titrated up. Okay. Now, you should know that many, if not most, I don't know if most, but certainly many patients, their gastrointestinal symptoms start to improve with time, with being on the medication. Okay. But that's not everyone. One thing that's going to help is slowly titrating and starting at the lowest dose. Now, what do I mean by slowly titrating? We usually always start at the lowest dose, but usually you can increase the dose after like week 1 for many of them. If you're having these side effects, well, then maybe you shouldn't be increased to the next dose. Maybe you should stay on that first dose for a little bit longer and see if you feel a little bit better, okay? So that flexibility needs to be had with you and your doctor about how you escalate your doses. I've also had patients where we escalate the dose because they're doing well, and then they start experiencing side effects. We're like, whoa. So we actually bring them back down to a lower dose. And then that lower dose tends to be like what they need to be on, okay? So there's flexibility with that. The other thing is you can also, and this is your doctor may also try withholding treatment, stopping the treatment, and then maybe resuming the treatment, okay? Maybe just that you need to sort of give it a break, get off of it, and retry it. And the other thing I've also done and considered with patients is sometimes changing the medications. Just like patients you may have different amounts of weight loss with different medications, you may also have different types of symptoms with different GLP-1s, and I've certainly seen that. So don't rule it out that maybe a different GLP-1 might be better for you, okay? Just keep in mind, not everyone's able to tolerate these at all. This may not be you, but understand that there are a lot of things you can do to try to sort of get through some of the symptoms or rather side effects if you have them with regards to gastrointestinal side effects. Again, there are many other side effects you can have. There are many other potential treatments and things you can try at home. This is just a start. This is just a dip in the bucket. So make sure you are talking to your doctor. What I always say is if you have any emergency side effects or symptoms, severe abdominal pain, nausea, vomiting, things like that will not stop, diarrhea, blood, anything, that is the emergency room. ASAP. Do not play around with that because we don't play around with that. We don't want to play around with you. I'm Dr. Jen Cottle, practicing family physician, on-air health expert, and video creator. Guys, please subscribe to my channel on YouTube. Please follow me on Facebook. I'm on Instagram, TikTok, LinkedIn, WhatsApp. Please also sign up for my free health newsletter at drjencottle.com. Love y'all.